and good afternoon. I act for clinically vulnerable families, and I'm assisted with by Hayley Douglas and Lamisa Iqbal, and we're instructed by Kim Harrison and Shane Smith of Slater and Gordon. CVF in this module will speak for two groups of children. First, children who are themselves clinically vulnerable to COVID-19. This is a small group relative to the 65 or so million people living in the UK, but still a sizable group of many thousands. And between March 2020 and October 2022, 88 children died from COVID-19. This number may well have been higher had many children of clinically vulnerable families, many parents of clinically vulnerable children, not kept their children away from school. In the first year of the pandemic alone, there were 6,338 paediatric COVID-19 admissions. And of those admissions, 259 needed paediatric intensive care. Those, my lady, are not small numbers. And it's important they're not undervalued because of their relative size compared to the adult population who were adversely affected. The second group CVF speaks for is the children who lived in households with clinically vulnerable people. That's a much larger group involving millions. And it's that second group that was very important to decision-making around school closures. And those two groups are the two that CVF speaks for. I'm going to make two broad points. First on safety, and second on that group of children who lived in clinically vulnerable households. So on safety, restricting attendance at schools is plainly going to be the main focus, or a main focus of this module. And like others, I'll refer to this as closing schools, although obviously, as you know, schools were never actually fully closed. The important issue at this stage, a few months before the hearing, is what lens will the inquiry investigate that issue? And my main task today, my lady, is to try and persuade you and your very hard-working team to look at this issue in a slightly different way than it appears we think you are doing. Essentially, the decision to close schools involved the balancing of two competing risks. On the one hand, the risk of harm to children for not being in school, for example, missed education, the loss of a place of safety and support for many vulnerable children. And that was set against the risk of harm to children and wider society of greater transmission of COVID-19, which would, it was assumed, and it was correctly assumed, would lead to the death and serious illness of many, particularly from clinically vulnerable people and clinically vulnerable families. And of course, clinically vulnerable staff as well were part of that equation. An exposure to the virus would lead to the NHS being overwhelmed. That was the assumption, and that was predicted by SAGE as likely to happen within 10 days at the point where the decision was made to close schools. So to put it crudely, the harms of the virus versus the harms of children missing in-person education. Those are the balancing factors which this module will be considering. Unlike full-scale lockdowns, there's a long history of schools closing or being very limited in attendance during disease outbreaks. And on the most basic level, school attendance is often limited during pandemics and epidemics because people rightly assume children in close proximity can spread diseases, as every parent knows when their children go back to school after the school holidays. And that means that many parents will not send their children to school regardless of whether the school is formally open or not. And that, of course, was already happening on the 18th of March 2020, when the Prime Minister announced schools would mostly become closed. Attendance had already dropped significantly. And that also reflects a historical picture. In the US, during the 1918 flu pandemic, some states closed schools and others did not. But in the states that did not, up to 50% of children were kept away. And that's all important context. It's not necessarily in the gift of the government to decide which children go to school during the pandemic. Parents will also be making their own safety assessments. And it's important, therefore, not to engage in wishful thinking. It's possible to say now, even before the oral hearings and much of the written evidence, that limiting in-person education had a deep, negative, and in some cases lasting impact on children. There were hidden harms as well as obvious ones. But we should be wary of reaching too simplistic a conclusion based on this, that school closures were bad for children, and therefore there shouldn't have been school closures. And I'm not suggesting the inquiry is anywhere close to reaching that kind of simplistic conclusion. The reality is that in a pandemic, school closures will often happen de facto because the public think it isn't safe to send their children to school. And that's particularly people who are clinically vulnerable because they don't want their children bringing the virus back to their home. And if you accept that, then the question becomes, how can we do two things at once? Keep the vast majority of children in in-person education, and at the same time keep them and their families safe from the virus. And we say that's the right question for Module 8 to ask. How can you keep children in school safely? And in order to answer that question, the inquiry must explore a related one. Were schools not safe enough to remain open? And if not, why not? And if you can answer that question, you might be able to keep many, or even most, children at school, even during a pandemic. But if you can't answer that question, a future government will probably discover that parents simply won't send their schools, whatever the policy and whatever they're saying. It's therefore very important to CVF that questions of whether schools were safe and how to make schools safe in future become central to this module. And that the inquiry requests and obtains the evidence to properly investigate it. And that's why CVF wrote to the inquiry alongside the TUC, Long COVID Kids and Long COVID Kids Scotland to request the instruction of a public health and safety expert to consider how school attendance restrictions may be avoided in a future pandemic by improving infection prevention and control measures. And we are grateful that a factual Rule 9 has now been requested from Professor Jim McManus. And we say that's a good start. But we also say that more will be needed. Respectfully, we challenge counsel to the inquiry's approach that it will be too extensive and time-reliant to consider this issue in a broad sense, because it has been considered in other modules. The inquiry in Module 3 instructed multiple experts to consider how health settings can be made safer in a future pandemic. So why not instruct experts, even the same experts, why not the same experts in this module, to consider how to make schools safe? And the conclusions of the IPC experts in Module 3 showed that there was nothing inevitable about public buildings being unsafe. Poor air quality is a choice. Buildings can be made safer by using IPC measures such as mechanical ventilation, air filters, high-quality FFP2, 3 and 3 masks, air quality monitoring, and other innovative technologies, as your lady has heard me say many times in this inquiry. There are also less invasive tests now, which are possible to use by children, even children with special educational needs and disabilities, which would allow for rapid detection and isolation of a small number. And all of that needs to be a central focus of this module, or the inquiry risks concluding that taking children out of school was bad, but not understanding and not communicating to the public how it could realistically be prevented in future. And we note that an addendum report has been requested by an existing expert in relation to long COVID. Why not request one in relation to IPC? The UK risks remaining vulnerable now and going forward, whether to new waves of the existing virus or to future pandemics, and even more so if a future pathogen poses a greater risk to children. Failing to consider this issue properly risks, to borrow from the TUC's excellent submissions, planning for the wrong pandemic. School closures do not have to be an inevitable response to a pandemic. In reality, they will be, unless something is done now to improve the safety of buildings children are educated in. And that is one of the key pieces of wisdom that this inquiry could offer the British public. With all that in mind, as well as proposing the instruction of an expert, we suggest, respectfully, 2 changes to the provisional list of issues. Number 26 in Roman numerals says, what mitigations were put in place to prevent the spread of the virus, and what impact did they have on children's well-being, to include the reduction in extracurricular activities which impacted children from poorer families disproportionately. The concern we have about that line is that it's going to consider the negative impacts without consider the positive impacts of mitigations. And we also propose that under school safety, a new line should be added. What safety measures were put in place to prevent the spread of the virus, whether those mitigations worked, and what infection prevention and control measures could be put in place in future to make schools safer. And secondly, the impact of any failures to put in place adequate safety measures on children and their families. My second and final point is that the inquiry must avoid adopting a Peter Pan view of childhood. It's important to put the impact of children of school closures in its proper context. Children do not exist in a Peter Pan world where they spend all day and night together without adults. A large percentage of children live in a household with a clinically vulnerable person, whether vulnerable to COVID-19 due to their age or underlying health condition or something else. The likelihood of living with a clinically vulnerable person is even greater amongst certain ethnic minority and lower socioeconomic groups who are more likely to live in multi-generational households. The sheer number of children in this category, together with the central role that they played in the balance of risk which led to government decisions on schools, would make any investigation that leaves them out of the equation somewhat artificial. If children are sent to unsafe schools, there is a significant risk of them bringing COVID-19 or some unknown future pathogen home to their vulnerable relatives. That is the risk equation which must be grappled with. And CVF respectfully suggests this key issue is missing from both the CTI's note and the provisional list of issues. And for some clinically vulnerable families, this is not theoretical or future or speculative, because the failure to put in place measures to reduce airborne transmission in schools means some children in clinically vulnerable families remain effectively excluded from education even today. And on that, we do ask that when considering the ongoing impact of certain children not going back to school, that should include children from clinically vulnerable families who have remained out of school, as well as the others that were mentioned and are important. The government's living with COVID policy framed risk as a matter of personal responsibility, shifting the greatest burden of responsibility onto those facing the highest risks. But public health should not rely on individual actions, but collective protection. When it's safe enough for the most vulnerable, it's safe enough for everyone. And that's my point. It's extremely important to CVF and the people it represents that the difficulties they faced and continue to face because of failures to make schools safe are properly reflected. And we therefore respectfully ask that in 4D in the list of issues, the distinct challenge faced by clinically vulnerable children, that is supplemented by and children in clinically vulnerable households. To conclude, this is one of the inquiry's most important modules, and it's of course important to identify harms to children caused by their removal from in-person teaching, but those harms are already fairly well known and accepted. In order to have a genuine lasting impact, we ask that Module 8 also focuses on school safety. Thank you.
Thank you very much.